I think for me, the elements that they've identified are actually relatively bang on, but what they need to understand, and I think we got to that in the conversation, was that if you're going to be changing models of care, there's so many factors that might actually impact. And you have to, so we talked about policy levers. This is terrible. So I'm going to do it again. Sure. Okay, so I'll start again. I think the discussion about the elements was really so important to us actually moving this forward, but I think our understanding of sort of the needs-driven, focusing on population health versus the models of care versus the policy leaders, as the conversations went on throughout the day, what we really started to understand is that complex relationship between all of these different elements, but then also the need to be very sort of simple and succinct, because in Canada, we're known to sort of boil the ocean and to take on too much. And I think at the end of the day, what we need to do is just focus and finish on possibly some real innovations around models of care for discrete populations in Ontario. Well, I think there's excellence across the province, and I think, as Ontarians, we should be proud of the work that we're doing around meeting the needs of patients, families, and communities. And I think we have to build off of that, like what's really working well in the province. So really what's so important right now is to get that current state understanding of what we're doing well, and then building off of that to then build in those core elements so that we can actually drive towards having the right care in the right place by the right provider.